What sports or activities should you avoid doing if you have scoliosis? This is one of the most common questions I get asked from patients, parents, and even adolescents with scoliosis. And in this video, I'm gonna go over specific sports we know increases the incidence or that have a higher rate of scoliosis for those participants compared to just non-participants. And I'm gonna go over what you should do and what you should not do, or things you should be aware of if you have scoliosis. Hi, I'm Dr. Chris Gubbels from Scolicare Denver. I'm a specialist in treating scoliosis. And in this video, I'm gonna answer your questions about activities that can increase the likelihood of having scoliosis, what to do and what not to do. So first, let me tell you about two different patients, and my response to their question on should I do this sport I want to do was completely different because their case was different. The first is a 16-year-old boy that came in with a mild scoliosis, and he was already risk 2, which meant his risk of curve progression was much smaller. And he wanted to know if he should avoid lifting weights, and he wanted to play football, and his mom was really concerned, is doing physical activities like football going to be dangerous to his spine? Now in his case, because he had a smaller curve that had a much smaller risk of progression, and he was already towards the part of his growth spurt where his rate of growth was slowing down, I gave him no restrictions on those activities. I really was not concerned about those activities increasing the likelihood of his curve getting worse. The second case was a 12-year-old girl that had a more moderate scoliosis. It was over 30 degrees, and she was a competitive ballet dancer. And they were wondering if ballet is something that she should be cautious of doing. Now, we know, and one of the studies I'm talking about, that people that do ballet have a higher incidence of scoliosis. However, I did not take ballet away from her because I knew that it was something that she really cared about. And so my approach was more about what should she do if she's gonna do ballet and she already has a risk of curve progression. And I'll talk about that in this video as well. So when we're looking at what activities someone should or should not do, there's multiple factors we really need to consider. One of those factors is the severity of the curve. Someone that has a mild scoliosis below 20 or 25 degrees may be able to do things that someone with a moderate scoliosis, 25 to 40, or severe scoliosis over 40 degrees may want to avoid doing. The other thing we need to look at is their age and their risk of progression. If we have an adult whose spine is more stable, we may have different recommendations for them than if we have an adolescent who's growing through the rapid growth spurt and has a higher risk of progression. So we also need to look at the risk of progression. Generally speaking, the earlier we detect scoliosis, the higher the likelihood of that curve progressing. Also, the severity of the curve makes a difference, and also where they are with the amount of growth they have remaining. So there's multiple factors that we need to consider. The other thing we need to look at, are there other things that are going on that increase the likelihood of their curve progressing? Let's take, for example, someone is done growing. If we look at an adult, we know that curves over 30 degrees have a higher risk of progression. If a curve is over 50 degrees, their curve is 100% gonna progress without treatment. So more severe curves, even when someone is done growing, we're gonna give possibly different recommendations. We wanna look at other things too, like is there an instability, like a lateral listhesis that tells us that the curve is unstable and is a higher risk of progression? Do they have a pelvic obliquity or one leg shorter or longer than the other? That's something we wanna look at. And is there other conditions going on that's driving the scoliosis? Does someone have a connective tissue disorder like Ehlers-Danlos or Marfan syndrome, where we know they're already more unstable and they probably have hypermobility? So there's a lot of things to consider when we're looking at what are some things someone should or should not do. So let's look at 3 different sports that have an increased incidence of scoliosis and the papers that actually, or the research that was done looking at these specific groups. The first one I'm going to talk about is the prevalence of scoliosis in ballet dancers. Now we're talking about ballet dancers. We're not talking about someone that does it once in a while. We're talking about people that are competitive. They're generally doing this multiple times a week. And in this study, the researchers looked at 30 girls between the age of 9 and 16 years old, and they compared those to 30 girls that were not participating in ballet. A couple of the measurements they were doing was one, angle of trunk rotation using a scoliometer, which is basically when someone does that forward bending test and you're looking for rib humping, we're looking to see if there's rotation in the spine, and if it's beyond a certain amount, generally in the thoracic spine, if it's beyond 6 degrees, or in the lumbar spine beyond 5 degrees, that's an indicator of rotation in the spine and scoliosis presence. The other thing that they looked at is hypermobility using the Beighton scoring method. Now, what they found was that 30% of the dancers, the ballet dancers, actually had signs of scoliosis. They actually identified scoliosis in 30% of the ballet dancers compared to just 3% of non-dancers. And so the authors concluded that dancers were 12 times more likely to have scoliosis compared to non-dancers of the same age population. They also found that dancers had a higher rate of hypermobility. They actually found that 70% of the dancers tested positive for hypermobility using the Beighton method of measurement compared to only 3% of non-dancers. And so the authors concluded that adolescent dancers, similar to adult dancers, are at a significantly higher risk of developing scoliosis compared to non-dancers. And because of this, they said diligent screening and improved education of dance teachers and parents of students is necessary so we can detect these things early on, and they can get the most appropriate treatment earlier on, because we know earlier treatment leads to better long-term outcomes. Now let's look at our second study and our second group of people, and let's look at scoliosis in rhythmic gymnasts. Again, these are not people that do gymnastics once in a while. These people that are competitive gymnasts. Now in this study, the authors looked at 100 different gymnasts, and anyone that they suspected scoliosis, they then did x-rays to either rule in or rule out scoliosis. And what they found was that the gymnast had a 10 times higher incidence of scoliosis compared to non-gymnasts. Actually, 12% of the gymnasts they looked at had scoliosis, and these are compared to non-gymnastic populations. Only 1.1 of non-gymnastic populations in the study had scoliosis. Now, the authors looked at a few different things. They looked at overall hypermobility of the joints. They looked at delayed maturity, which delayed onset of menstruation. And they also looked at repeated asymmetrical spinal loading. And what they looked at is gymnastics. There's something that contributes to the etiology or onset of scoliosis. And they actually labeled this a dangerous triad. And they said that there are three things in gymnastic populations compared to non-gymnastic populations that increase the likelihood of developing scoliosis. Include generalized joint laxity. Overall, they generally have more hypermobility compared to non-gymnastic populations. Delayed maturity. Females in gymnastics tend to have a later onset of menstruation compared to non-gymnasts. And they also noted that repeated asymmetrical loading on the spine, which is basically repeated physical trauma to the spine. So overall, we know that gymnasts and adolescents are more likely to develop scoliosis than non-gymnasts. Now, the last study I'm going to go over is really interesting because we're looking at competitive swimmers. And historically, swimming has actually been something that's been prescribed for people with scoliosis. However, the authors in this study actually found that those recommendations to be contrary to the results. They actually found that people that do competitive swimming had a higher incidence of scoliosis compared to non-competitive swimmers. So let's dive into this paper. And they looked at 112 swimmers compared to 112 non-swimmer populations that were matched for age and population. And they measured a few things. One, they had the people fill out a low back pain questionnaire, which is a questionnaire about, do they have back pain? And if so, what kind of back pain, how frequent, things like that. They also measured their angle of trunk rotation using the scoliometer, which is an indicator of scoliosis. Then they measured their hyperlordosis, or their lordotic curves, and their kyphotic curves, meaning the size of their kyphosis and the size of the curve in their low back with a plumb line, and they measured the distance from that plumb line, which indicated what those ranges were. Now, what the authors actually found is that swimming is associated with an increased risk of trunk asymmetries and hyperkyphosis. They also found that there's a higher prevalence in low back pain in female swimmers compared to non-swimmers. So their overall conclusion was that while swimming has been considered a treatment typically for scoliosis, their data suggest that this is not something that should be recommended. So those are three different sports we know you really need to be aware of if you have scoliosis or if your child has scoliosis. And also, if your child does these activities, you 100% want to get your child screened for scoliosis. So we know that if you do competitive ballet, if you do competitive rhythmic gymnastics, or if you do competitive swimming and you're an adolescent, we know that you're more likely to have scoliosis, or at least people in those activities are more likely to have scoliosis compared to people that do not do those activities. Now, those are 3 sport-specific things. Now, if you're watching this video and you think your child has scoliosis, or you know your child has scoliosis, or maybe you as an adult have scoliosis, but you're not sure what to do, what you can do is you can actually click on the link below and you can request a free discovery call, and that gives you a chance to talk to me about your case. We can go over the severity of your curve or your scoliosis, the likelihood of it progressing, and what treatment options you may be a candidate for. So just click on that in the comment section below and we'll be happy to set up a time to discuss your case. So those were very sport specific, but what about just physical activities in general? Are there certain things people with scoliosis should avoid doing? As I mentioned earlier, that really depends on each case, the severity of your curve, the risk of progression, and is there other secondary things going on like instabilities or other conditions like Ehlers-Danlos or Marfan syndrome. But let's go over some general things. If you have a moderate to severe scoliosis or an unstable scoliosis, one thing you want to avoid is doing repetitive pounding or compounding activities. Things like jogging, doing box jump. Those are repetitive, high impact activities. If you're a runner, the reality is doing sprinting is less stress on your body than jogging. Also, going for hikes, like long hikes with heavy packs, if you have a larger scoliotic curve, and then you got a really high intensity things that do repetitive pounding, you might want to avoid. Heavy lifting, if you have a moderate to severe scoliosis or a scoliosis with a higher risk of progression, doing things like heavy squats or heavy deadlifting, those are things you may want to avoid. Now, I'm not saying you shouldn't do those at all, but maybe do lighter loads, maybe a higher frequency. And this is really, because that excessive loading on an already weakened spine could accelerate the rate of progression. And then doing activities that require repetitive asymmetrical movements. A large percent of my older population, they really love doing golf. And golf is you're doing an asymmetrical or a rotational movement repetitively, and it's generally one way. So one tip I have for that, if you're doing activities like golf where you're swinging constantly one way, or maybe you're doing baseball or tennis and you swing the same way a lot of times, then you actually want to do some things or build some things into your routine where you're swinging the opposite way. If you're a golfer, take some swings the opposite way to counter where you're always swinging. Same thing with tennis or like activities. Just whatever you're doing, look at the motions you're doing and then do the opposite to just counterbalance those asymmetrical movements. Now, if you have scoliosis, what should you actually do? And this is a really important point because I talked about ballet dancers, gymnasts, and swimmers. And my viewpoint is when parents come in, sometimes they ask, should they stop their child from doing that? I was an athlete myself. And in my experience, when I was a college wrestler or a high school wrestler, if you told me that I could not compete, I would not listen to you. I actually had a hip injury when I was playing football in high school, and it almost kept me out of wrestling my senior year. And I would have done anything to compete. So I don't like taking people away from things they love. But in order to do those things, make sure they aren't causing more harm, that motivation is to be very compliant with treatments and specific treatments that can help with scoliosis. So a couple of things I want to touch on. One is scoliosis specific exercise or scoliosis specific rehab or physical therapy. This is completely different than general physical therapy. If you know you're doing things that maybe aren't great for your spine and you have scoliosis, we need to do some things to counter that. So scoliosis specific is one of those where we can actually teach you how to put your body in the proper position, and we can strengthen and stabilize you in the right position. Now, if you're liking this content, be sure to hit the thumbs up button below and subscribe so we can notify you when we release new content on treating scoliosis. The other thing we may want to consider is ergonomics. So we can look at what are you already doing in your everyday life, and is there things can we improve? Your workstation, make sure you're not doing excessive bending, excessive rotation. So look at ergonomically in your environment. That's part of scoliosis specific exercise where we actually teach you how to actually do your normal activities of daily living. How can you do things you already do in your everyday life while you're holding your body in a correct position. And the last one is bracing. Bracing has been shown effective in reducing curve progression in both adolescents and adults. But poor bracing gets poor results and good bracing gets good results. So every brace needs to be custom made for each individual patient, and the goal of treating an adolescent or juvenile is completely different in a goal of how we treat adults. So the braces have to be designed differently. So in our next video, the video right over here, I'm gonna deep dive into the most effective treatment options for scoliosis. So click on the link and I'll see you there.